Amit, I am super excited for our next guest.
Yes, I have to say, it's been a while since we've got to get a position where we can get here. And I have a big connection with this particular individual.
Okay, tell
So
us.
we were training together. We were trainees together. We cycled through many of the same hospitals together.
But she doesn't look 60 years old.
She looks much younger than I. You're absolutely correct. So we are joined by none other than Dr. Athmaja Thottungal, anaesthetist, regional anaesthetist, pain physician, and lifestyle physician, amongst many other things. Athma, thank you so much for joining us.
Thanks for coming.
Thank you, both of you. Such an honor, such a pleasure. I mean, you both, as Amit said, we grew up together in the field of regional anesthesia. We both were fellows of Rafa Blanco.
That's absolutely right.
Oh,
and
okay.
El Sora London Society of Regional Anesthesia. And we were like Jeff Godson, like God of regional anesthesia. And
we looked up to you, even though you're the same age as us. Just to clarify.
Wait, what?
Yeah.
But it is such a pleasure. And we listened to your podcast and, your dad jokes. He had it even from that time.
Yeah, it wasn't something I developed
I think he comes by it naturally.
Yeah, that's right. Yeah. Such a pleasure. Such a pleasure.
So when Athmaja talks, I cannot help but force myself to stop and slow my breathing down and relax. There's something about the way that she talks that has such a calming influence. So there is a whole other side to you that we don't know about, right? So we talked about sticking needles into people and regional anesthesia, but there's a whole other side to you. So to tell us a little bit about what you do outside the traditional regional anesthesia, and then we're going to talk to you a little bit about how we can improve ourselves and make life beneficial and better for us. So tell us about that.
So officially, I will tell a little bit of history behind it. Like everyone else, I did my medical school as normal, conventional medical education. Then I was interested in surgical field always. So I did 6 months of pediatric surgery because I really like surgical side. But I kind of realized emotionally I was so distressed every day seeing these kids suffering. I said, I cannot continue this for my entire life. So I moved to the happier side of pediatrics, which is obstetrics.
Okay.
So I worked as an obstetrician for 2 years.
Whoa, I didn't know that.
This is where...
We're learning so much. This is what's amazing.
This is where I saw women suffering with pain. Pelvic pain. And pain itself is a dark specialty in anesthesia. Nobody is interested. As soon as you hear the word chronic pain, eyes rolling upwards and nobody wants to know. And in the pain world, pelvic pain, especially female pelvic pain, is the darkest corner of that specialty. One, we don't know what to deal with this, and we don't want to kind of acknowledge that women are suffering. I thought something has to be done about it. So I changed my career to become an anesthetist, to get trained in pain.
That was always your end goal.
Correct. So that is why my subspecialty interest is in pelvic pain, in upper pelvic pain.
Okay.
But as a doctor, as a person, I was always very close to yoga because that was part of my dancing training and everything to get focus.
Wait, are we dancing on this podcast?
We are not. Dr. Thottungal can dance.
Yeah, so it was there in my blood. And always I knew something is not right the way we are treating our patients. Something is missing somewhere. Until I became a Persian myself, I realized everything that we look at is symptom management. We never talk about the root cause analysis of the problem. We are very good at treating acute problems. Like you come with a heart attack, I still go to a medical hospital to have my thrombolysis done.
Yeah.
Once they are done, you check them out.
This is so true.
Yeah.
You treat the acute problem.
Yes, we
not
never
the
think
cause.
why this patient had that one. Was there anything that could have been prevented? And what can we do to prevent happening again? We never think. Same with the pain as well. Regional anesthetists, we are trained in the theater. What can you do? Where can I stick a needle in? How much pain relief can I provide, or zero pain in the recovery? Once they are out of the recovery, that's it.
Well, we don't see it. If
Yes.
we don't see it, it doesn't happen. Therefore, it's not a problem.
Correct.
Right.
As a chronic pain specialist, I picked up these patients at the end of their journey, way down. And when you look at their journey, we pick up so many points, we miss the boat.
Right.
Or we could have probably changed around it. But I was not doing anything formally at that point. COVID came, long COVID happens. I had a long COVID. I became a long COVID patient.
Really? Okay.
That was the time, as a patient, you see a completely different perspective of medicine. People were looking at me like a symptom rather than a person. They wouldn't correlate symptom A with the symptom B.
Right.
They wouldn't even connect those two dots together. And then I started my own research, and this is where I realized the most important features that we can modify or are important is patient factors. So if you look at any of these articles published about the prevention and factors, risk factors, predictive risk factors,
Yeah.
lifestyle factors and pre-existing pain is the major factor than our regional techniques.
Yeah.
Even surgery.
So if those conditions exist before a surgical insult,
Correct.
that is going to influence what happens afterwards much more than what we do that lasts
Yeah.
16, 18, 24, 36 hours.
Correct. We make beautiful slides for our presentation with, the risk factors, catastrophization, anxiety, depression, sleep deprivation, previous or opioid usage, female gender, obesity. We put the slides on our presentation. What do we do about it?
Nothing.
Nothing.
Yeah.
So this is where, as a patient, I decided I need to have a formal training. This is where I did the lifestyle medicine degree from the International Board of Lifestyle Medicine and the British Society. So I am dually certified. Then I thought, oh my God, I can change the world.
Yeah.
Yeah. I realized patient didn't want to change because as doctors, we are taught to prescribe.
Yeah.
So that's what they're expecting?
Yes.
A prescription?
Prescription. But as patients, nobody likes their autonomy being taken away. Their power is taken away. You say, you have to stop smoking.
Yeah.
You have to lose weight. If they could, they wouldn't be in that position to start with.
Yeah.
Can you prescribe a treadmill?
Correct. How can you prescribe? You say, go and reduce weight. They can't do that.
Yeah.
That is why they are there.
Yeah.
I went and inquired, how can I become a better physician who is in partnership with the patient and where I can empower the patient, putting that responsibility back into the patient's court. So I went and did a health coaching certification from Institute of Integrated Nutrition, where the nutritional part of lifestyle medicine is very important, and coaching, how you become a good coach for the patient, which made a big difference.
Okay.
So now by changing the language that I use, patients feel they are making the decision.
Yeah.
They are
Isn't
deciding
that
to
so
stop
clever?
it. They will stick with it because it is your rule and your decision, not mine.
I do that with my surgeons. I make them think that they asked for the block. It was really me asking
That's
for the
Star
block.
Wars. You
Yeah.
must have a block.
That's really clever of you to combine those, to have the insight to say, okay, I have the knowledge to make you better, but you're not listening to me, so I need to become a coach
Correct.
to have
See,
those skills.
How many people
Exactly.
would go and educate themselves
I
or
mean,
train
it's-
themselves to become better?
Exactly.
They'd be like, oh,
That's
well,
ama-
patient's not listening to me. That's
So-
what, yeah.
No, this is what is. So the change in the thought process was number one player in the world in any sport. They have a coach.
Right.
Why do they need a coach? They are the number one. Coach will always show you your blind spots.
That's a great question.
I mean, because this guy's number one. Why does he need to be
Why
taught by
does
somebody who's
Federer-
maybe not good as playing
Yeah.
as he?
Correct.
Because the coach may not be
Yeah.
as good a tennis player as the number one player.
Blind spots. Okay.
So coach is not a trainer.
Right.
Trainer will train you the technique. We are all educators and trainers.
This sounds like it should be obvious information, but it isn't necessarily, is it?
For me, it was showing my blind spot as a trainer.
Yeah.
So now I am becoming a coach for my trainees.
Right.
Not necessarily just a trainer.
Right.
I coach them. so that they can see their blind spots, they can improve. They are all skilled, they are
Do you
professionals.
train your fellows? Do you mentor your fellows? Or do you coach your fellows? Or do you all do all three?
I would love to say that I do a little bit of both, but I probably need to do a better job at the coaching part,
Yeah.
I think. Yeah.
Yeah.
So can you give us an example of a patient interaction? Like when do you see them?
Okay. So this is where we feel as professionals or regional anesthetists, the most important part is the regional anesthesia. Nothing else in the world changes. So, like today,
No, we don't think that.
both my lectures were about how the lifestyle factors need to come in.
Okay.
And I'm going around educating everybody to understand when we see a patient, we need to see the whole patient,
Yeah.
not just that particular thing. And ESRA is like actually taking that initiative to form a new working group called POPOS, Perioperative Pain Optimization, which includes, it's like an umbrella term for including the lifestyle factors, the patient factors, the pain factor preoperatively, continue that transition through the intraoperative period, and also fill the gap between the acute pain 3 months, chronic pain 6 months, that gap, and bring all these people, everyone together around one table. How we can make the journey of a patient much more useful and more productive, and whatever money we are spending, we need to have the value for the money as well, which is so important, rather than everybody working in silos. All these things, I personally as a doctor, I learned a lot in this journey, but as an individual, I realized how important it is to look after yourself.
Yeah.
You're that, care the carer first.
Yeah.
You need to be, see, if you are anxious, if you are not in your best emotional state, you will not give the best care for the patient.
Yeah. That's
so
true.
You need to look after yourself. And actually, doctors and all healthcare professionals are the worst patients as well.
I can 100% attest to that. I think there must come a point in everyone's life where, so I think I felt I was cruising for a while, and there came to a point when suddenly I started to feel a bit more anxious about things, or you have life stresses or things take over. It's very difficult not to let that translate into the practice of what you do, and we all try to separate our work life and our home life. But if you're stressed and you're worried about things, so what are the strategies that we can employ as individuals to be healthier, to be less anxious, to deal with the symptoms? Because I feel like this thing is maybe not great, because my life revolves around the thing that I'm holding in my hand. Just for clarity, if people are not watching on video, I'm talking about my phone as opposed to anything else. But so everything that I need to know and do is based upon this. What are the type of things that we can do to have a healthier, a cleaner life?
It's people think, it is very difficult to do. Actually not. It's about the change in the perception and what we think is important. When, as a doctor, you are dealing with an emergency, whether it is regional anesthesia or anesthesia, are you thinking about your phone at that point?
At that moment, I really hope not.
Yeah.
Correct. Precisely. So we are focusing on the patient. So this is all about how we learn to focus on something by prioritizing it. You can do very simple tactics in your life. For example, the first thing in the morning when you wake up,
I know what she's going to say.
Yeah.
don't have your phone next to you.
Yeah.
You have to stand up, go get the phone and do it if you can't control yourself.
Yeah. I'm guilty of that too, because I use it as an alarm clock.
Yeah.
And then the first thing I do is like, what's new
going
today?
Through going through the phone, your dopamine is
What did I miss? What did I miss overnight?
Correct.
What did Amit
That
text me
FOMO.
overnight?
Yeah.
Then your cortisol is through the roof already.
Yeah.
Even before you get out of the bed, your blood pressure is up.
Yeah.
But why is it? You're right. But why? Why are we getting wound up? What is it? Or what is it?
The dopamine is more addictive than anything else. Actually, that is why everybody gets addicted to sugar. Sugar is more addictive than even your cocaine, because your dopamine surge. Why the kids are so glued to the phone?
Yes.
Because it is the dopamine, and they get the dopamine withdrawal. So it's just like, I have to do it. So I practice yoga and I take a conscious decision at least once a year to have a electronic gadgets holiday.
For how long?
That depends upon how much time I can have. Like this year, I had 3 days
Okay.
complete.
No digital
No,
contact
no,
at all.
just leave it. Phone is there. Phone is there that if you need an emergency or whatever it is there. Like now we started this podcast.
Yeah.
You put
I
your phone
immediately
away.
put it on my phone away and in the aeroplane mode.
Yeah.
So
Right.
nothing is going to come.
Right.
So it is there as a tool.
How are you feeling right now? You a bit jittery?
No,
No,
she's
I mean,
I'm
I'm
not.
joking.
She's
Yeah.
No, I'm
No,
not.
but I
This is
might be.
Yeah, this is what,
Yeah.
See, I know that it is there in case of an emergency or anything. I have got the access to the tool. That is a tool for me,
Right.
not my life.
But when you are doing your digital detox, say for 3 days, do you couple that with when you're on an actual holiday or a
Yes.
break? Because presumably, if you're out to work, it's not possible.
You can do micro digitalize toxicity removal as well from your life. Like for example, when you get up in the morning, I wake up with gratitude. Gratitude is a emotion for you to bring your body vibration. We all know that we have a frequency in our body that brings to the highest level possible for you.
By having gratitude, you
Gratitude.
take your body frequency to the highest level.
Yes.
I love that.
How
I-
many times have you said thank you in your
I'm
mind
getting goosebumps when she's saying this because
to
it's-
your parents,
yeah,
your loved ones,
yeah.
your children, your wife, your dear one, near ones, your friends,
Yeah.
whoever it is, even being just alive, waking up in the morning.
The
Yeah.
answer is not enough.
Correct.
Yeah.
The answer
So
is not enough.
take that 5 minutes for you,
Yeah.
or even few minutes.
This feels like
being grateful.
counselling for
That's
me right
yeah.
now.
Yeah. Feel free to charge us for this too.
I mean,
But that's so
simple thing.
true.
So
We don't.
I love that concept that embracing gratitude helps your health.
Absolutely.
Yeah.
That brings your cortisol, because naturally in your circadian rhythm, morning cortisol levels are high
Yeah.
in your body.
Okay.
And by looking at your phone and going through the social media and all these negativities around you, you are just skyrocketing that through your.
Yeah.
And once you have that cortisol up, your sugar is up, all your immunosuppressants are high in your body. Why do you start on the wrong foot in the morning
Yeah.
itself?
Yeah.
Yeah.
This is inspiring me, but what? Okay, let's be pragmatic or practical about it. So I totally get. Don't make it be the first thing you reach for.
Correct.
I think I can do that.
Yeah.
I think I can do that. But in reality, the jobs that we're doing a podcast, there's a little bit of promotion, but there's also natural curiosity. We are using these platforms.
Correct.
Is there a way to be sensible with how you use them?
Absolutely.
So limit the time period with which
Correct.
you engage with certain
Yeah.
platforms?
Don't you put restrictions on your children?
Yeah, we do try.
Yeah.
We do.
Do you
Yeah.
know, we have our kids, we were late to get our kids phones because we were concerned about exactly this, right? So our 2 older kids have phones, our 2 younger ones don't. But the rule is it can't go upstairs.
Yeah.
So at nighttime, in
Has
the
to be
evening,
docked,
plugged
yeah.
in the dock and they're upstairs. But my wife and I have our phones at our bedside tables.
Correct.
I wonder
This
if we
is
should
the
be putting
second. Correct.
we should be putting ours downstairs
Simple
too.
things.
Maybe just buy an old-fashioned
Old-fashioned
alarm clock.
Yeah.
Yes. Do you know, I tell my patients, bedroom is for sleep and sex, nothing else.
Oh my gosh.
Honestly.
Yeah.
Yeah.
It shouldn't be for anything else.
No electronic
scrolling.
gadgets, no TV, because the blue light,
Oh, it's horrible.
when you have in your brain, that resets your biological clock, because your melatonin production is depending upon the first blue light ray coming into your
Yeah.
mind.
Yeah.
16 hours zone, your body produces melatonin. So when kids or ourselves are like scrolling through the TV or phone, your melatonin production is low. So your sleep quality is poor. If you ask me one thing, other than, forget about the food, whatever it is, one thing that you have to change in your lifestyle, quality sleep.
Quality sleep. Wow.
Quality sleep.
I know the answer to this, and I'm going to ask you, how much sleep do you get per night?
Okay, so it used to be not enough, used to be not a lot, and then I read this book, Why We Sleep, by Matthew, I forget his last name, but it was horrifying. The first part is like the physiology of sleep, which I kind of knew about, like REM and non-REM, and then the second part was all the bad stuff that happens to you when you don't get enough sleep. And the horrifying message was, it's not reversible. Like, what's done is done. I've done the damage. I can't, like, I used to think, oh, I'll catch up on the weekend.
You can't catch up.
It doesn't
on
work
that,
way.
right?
Yeah.
This
Anyway,
is not about the duration necessarily.
It's the quality.
It is the quality of sleep and how deep sleep you get it, because you produce so much of waste and things in your body. All the cleaning up process, your repair, everything is happening, including your DNA repair.
So we are not allowing our DNA to be repaired properly
No.
by not sleeping.
Correct.
and that's why cancer rates
Correct.
are associated with inadequate sleep.
Dementia.
Wow.
Yeah.
So I no longer have caffeine after noon.
Afternoon.
Well, I guess I'm
Yeah.
having some now, but
It's again, you
Trying
know,
to.
some people are very sensitive to caffeine.
Yeah.
Some people are not. But the general advice is, if you can avoid caffeine later in the night, always good
Yeah,
for you.
yeah.
And as doctors, by default, we put ourselves under a lot of stress. Like, for example, the night shifts and things like that, it disrupts our circadian rhythm big time. On top of that, you know, risky substances that people use on, and the stress level that we go through, and lack of sleep. That is why doctors after a certain age, they have the highest incidence of medical problems, stress related problem, and early death.
can I ask you a question?
Of course.
So, avoid blue light close to bed. Avoid caffeine if you're, close to bed. Alcohol. I'm hearing more and more about, I know about the effect of alcohol on sleep, but I'm hearing more and more about the effect of alcohol on just,
Everything.
how long you'll live. And,
Yes.
and there are more and more people I'm hearing about that are just giving up alcohol altogether.
Yeah. Alcohol, smoking are well-known risk factors.
Yeah.
But I would add sugar to that. We are bringing up a generation of children who will be living at least 6 to 7 years shorter than their parents, purely because we are making them metabolically unwell from a very early age. Would you give your children alcohol when they are 4 years old?
No.
Only if I want them to sleep.
No. Yeah. Okay. Yeah.
Yeah.
Why do you give this much processed food and alcohol, sugar to them?
Yeah.
So that is why we see young children as 9 years old, 10 years old coming with a fatty liver, non-alcoholic fatty liver, and this is becoming the next ticking time bomb, diabetes and non-alcoholic fatty liver. There is a lot we need to do as doctors.
I think we need to get a whole episode or two with Athma on it, because we could speak to you. We could listen to you forever. There is a wealth of information in here, presented in such a calm and beautiful manner that I could listen to you speak for hours.
Yes, agree.
So thank you. I don't
Thank you
feel
so
that
much.
I don't want to spoil this by asking for a joke. I think we've just left it with lots of things to think about, and it would seem too trite to introduce a sense of humor to this bit.
Or just because you asked a joke and it is in the lifestyle related.
Okay, go for it.
I'll tell you something. When is the worst time to have a heart attack?
Oh gosh. Oh my god, this is
Okay.
no idea.
When you are playing a dumb charades.
When you're playing a what?
Dumb
Dumb
charades.
charades.
Yeah.
So help me with that.
Oh, yeah.
Because nobody will believe you that you are having a heart attack.
I got it. It's
heart attack. Yeah. Hey, don't break my heart. Very good. Wow. She made us think about that.
Yeah, it was
Athma,
good.
thank you so much for
Thank
spending
you
your time
for
with us.
joining
Really
us.
appreciate
And,
it.
it's so, how can I say? It's again, overwhelming happiness to see you both doing such a wonderful job and spreading the word of regional anesthesia, and also making it so cool.
Oh,
You know.
try.
Well,
I'll try.
thank you.
Thank you for being
So
an
good to
honest
see
guest,
you.
and I think we've got to
Thank you.
get Dr. Athma on as an episode.
Yes,
just for
if you'd
her.
be willing to.
If you could
Absolutely.
bear us again.
Absolutely. Always good to talk to you guys.
Thank you very
Thank
much.
you very much.
Thank you.